Okay, it's me again. So this is part two. This is actually the PET area, which is another type of machine that we use for pharmacological. It works really well. It's also a CT scanner, so it works really well for someone that has a lot of extra tissue, if you know what I'm saying, around the chest area, someone with larger breasts, or even just a larger person in general. It takes pictures really deep. So I'm going to show you this camera. It's pretty awesome. We just got done using it today. So hang on, I'm going to flip it around. And here we go. So this is the PET machine. It's a big old machine. You can see the hole there. It is a CT scanner. It's making a little bit of hum noise. She's calibrating and stuff. So the person will slide right into the hole, right in there. They lie on this bed here. We'll raise it up and they'll slide into the camera. So they actually do a CT scan first where they kind of do the in and out of their pictures. And then when we're ready to do the heart portion of it, their head sticks out the other side. So you can actually see their head sticking out the other side. I hook up to the blood pressure cuff as well as the EKG wires and everything. We usually put a cushion like this under their knees. Let's see over here. So this must look familiar too. Our wipes, gloves, everything. This checks for blood sugar. So here's my stress machine here. Again, and all the wires. You can see they are all the same colors that we're used to at school, right? And again, they have those clippy things. And you always put the metal side down. But at this machine, because we have this whole big machine, this is the really fancy blood pressure cuff machine I have here. It's a touch screen. I can get vitals, I can get their heart rate, respiratory rate, and everything I need. I can actually just hook them up to some leads and see a little wave across this too if they're not actually hooked up to my EKG machine. So this is a pretty cool little thing we have here. But up here in the window, you'll see the person's name typically. But because this machine also paces with their heart, I actually have to add 3 more wires to them. So they wear 13 wires and 13 stickers. So you can see there's 3 more wires that I would have to attach. I want you to think about those colors and where they would go, where they would be placed. So these are extra stickers. I already placed 10 on there. I'm gonna put 3 more on. And these are colors you should know. The white goes where? On the right, so that's going to be on the right arm. You notice the other 2 are black and red, so those don't go on the right, those go on the left arm and leg. And that makes sense because that's our Einthoven's triangle, isn't it? And that's the green one, the right leg, is ground, so we leave that one out. So these 3 are what help pace this big machine here. It's a really awesome machine. It's kind of chilly in here. We have to keep it at a certain temperature so that the crystals inside the camera here are able to work properly. So I'm going to take one quick walk around. Here is kind of like home base, and you can see Teresa is going to be sitting at her desk there. She's just looking over the pictures she took of the last 2 patients we did today, and going to send them off to the nuclear medicine doctor and the cardiologist to come up with their diagnosis for the 2 patients we had today. So back here behind the camera, you can see this is behind the camera. This is where the nuclear medicine material is kept, and it's radioactive. So inside this whole box here, it's all lead, so that we are not exposed to it as workers using this every day. So it's infused through here. They can just give a dose. It's measured out, and they just give a dose right through the IV, and that allows them to pick up gamma rays off the patient to take pictures of the heart or whatever part they're imaging. So it's a pretty cool system back here. So this is PET, and I will walk on out of here, and you can see everyone knows what that means, right? Because I am in PET imaging in the nuclear medicine department. All right, talk to you soon. Bye.